turn out fine. But you gotta keep your head up, oh, and you can let your head down, hey. You gotta keep your head up, oh.
Yeah, you do. You got to keep your head up. Good evening, and welcome to the Carolyn Holt Show. I am very excited about tonight's show. I have a very brilliant person to help me navigate the healthcare system. And we're going to talk to her in a minute. But I tell you, it is scorching hot, not only in Southern California, but in this studio. So we are literally two hot women tonight. That is literally because it's just hot, but we're going to make it through this because we're going to keep our heads up, and we're going to do a wonderful show for you. Tonight, I have Kim-Lai Jones, who is a partner with NELLA Insurance Partners, and NELLA Insurance Inc. Is that it? Did I get it right?
NELLA Insurance Services.
Services, okay. Services, Inc. And she is going to help us to navigate this thing called single payer in reference to the health care, which still has not become a law, and we don't really even know what's going on with it. But I know that a lot of people have a lot of concerns, and that's understandable because they listened to 45 when he said that one of his campaign promises was to have cheaper, better health care. And I think people are still waiting on cheaper and better. And perhaps the truth of the matter is that that may never happen. But there's this word going around called single payer. And most people are like, well, what is that? And is it really beneficial? And how does it affect me? And so Kim and I, we're going to talk about that tonight. And hopefully by the end of the show, you'll have a clearer and better understanding about the little that I know about healthcare. So good evening, Kim. Thank you so much for coming and welcome to the show.
Thank you so much. I appreciate you having me.
Well, I tell you, you're the only person I know that really gets all of this healthcare industry and how it affects the lives of the day-to-day folks like me. And so tonight we're gonna get started with just the campaign promise of better, cheaper health care. Now, is that true? Can you have better, cheaper health care? Is that really a realistic thing to buy into?
I highly doubt in this current political environment that we can have better, cheaper insurance. I don't think that the powers that be at the current moment are really interested in the insurance being better. Less expensive. They might be focusing on that as a monthly out-of-pocket cost, but it's not ultimately in the end going to be less expensive because there will be higher out-of-pocket cost. So it may be cheaper when you write your monthly check for your premium, $100 versus $120. However, when you go to the doctor, you have to pay more money out of your pocket, and that $20 savings is out the window.
Wow. Well, I think that's where people are upset and maybe even confused because they're trying to figure out how to keep some money in their pocket because they feel that they are already maxed out in terms of what they really want to pay, because I think they had a different thought about what was going to happen. So,
well, most people, if they purchase health care, most individuals want to use it. And when they go to use it, they want it to cover almost everything. But the truth is, most plans these days that are reasonably affordable have a lot of out-of-pocket copays and deductibles. A lot of the plans right now have maximum deductibles of $6,500 a year, which is, on one hand, not a lot of money if you're very sick. Knowing that you cap your costs around $6,500 a year, it's great. On the other hand, if you have to pay that out before you receive primary services, then that's a lot of money. So it just depends. You can look at that two different ways.
That's true. But in terms of the buzzword of the moment, which is single payer, what would you say the truth of the matter is regarding single payer? Because it appears that it's already a system that exists. It's just that maybe lay people have not heard the term. Maybe that's it. So
well, single payer. The system of single payer exists in Medicare.
Okay.
Medicare is a single payer system. Everyone signs up individually. You receive your services and pay one company. You pay the government if you have a supplemental benefit. So,
right.
It is a single payer system. It is a very cost efficient system, and we could model private health care after a single payer system. However, there are a lot of pushbacks to do that. Big business wants to push back against doing that. Healthcare wants big health insurance companies want to push back because that means everyone would be insured and not just a small segment of the population, which means that health expenses could go up on their end. So a single payer system, it can work. It is completely doable. I do believe if any state does it, it will probably be California.
Well, I believe that as well. But we're going to go back to your statement about everybody instantly having health care under a single payer system. Now, I would think that most people would think that that's a good thing. Everybody having coverage. However, there's when you really examine it, there are some issues that
there are issues when you think about everyone having coverage. Well, you want everyone to have basic primary coverage for sure. There's certain services you want everyone to have: free healthcare screenings, preventive services, things like that. It gets to be more sticky for a lot of individuals when you say, we want to provide healthcare coverage for all. But if someone has a severe disability, if they have extenuating circumstances from birth, how much do you pay under a single payer system? Is that unlimited as far as cost and different things are concerned? That's one of the issues that is prevalent right now, even in the healthcare system that we have now. How much do you pay? How much do you and there's no value on one hand for human life. I don't think you can really put a number on it. But I guarantee you a health insurance company can.
Yes. Well, their job is to assign risk and see what that looks like in terms of the bottom line. But I think the issue is that Canada has it, and it works. Certain places in Europe, it works. So what's the difference? Why can it work in Canada and why can it work in Europe, but yet there's this the fear factor when it comes to here in America?
Well, here in America, we don't want to pay for it. That's the bottom line. I mean, in Canada and in Europe, where they have healthcare, basically single payer systems, they pay a much higher taxes in this particular area than we do. And we are a country that believes that, taxes should be lower, as we constantly ask for and need more services. So those two things are in direct conflict. We want more, benefits and services from our government on one hand, but we don't want to pay higher taxes. So that's one of the main differences between, and the reason why it works there is they are willing to pay higher taxes for this benefit because they understand the value of the benefit.
Okay. Well, but I'm thinking, because I'm going to say that Americans are smart. So what in the conversation, which you say is missing, that perhaps needs to be added so that they buy into the fact that if you're going to get this, which is something that benefits everybody, that it's okay to pay for it. And no matter what it is that you have to figure out a way to pay. And generally, taxes is where it starts. So what would you say to people that are reticent about the fact that taxes?
It's just something that's going to take time. I mean, more than anything, I mean, really, we can talk about healthcare, the need for healthcare, until people really begin to take their own individual health seriously, and we begin to take our health seriously as a society, meaning where we are where we preach across the board healthy lifestyle. In all segments, meaning, we provide enough public transportation so people can walk or bike or drive, instead of driving. And so, we just have to evolve to that point. That is just really what I believe. I just think that it is going to take time. We haven't really considered healthcare and really valued healthcare. If you really look at the history of healthcare as a society, we haven't placed a lot of weight on it.
Right.
Because we were so healthy, I guess you can kind of look at it. But now we have so many different issues. And it isn't just minorities who are having these issues. We're having health issues due to our eating habits across the board, obesity across the board, diabetes across the board, heart disease across the board. So I think as we understand and we educate the public more just about how important good health is, how to age gracefully, and how important that is to really get people to understand, what you do when you're younger really does impact what happens to you when you're older, and what type of life you can lead and when you're older. So I do think those things will come. It will take time. We're just starting to have the conversation, though, if you really think about it.
Yeah, but, but we're living so much longer than we used to. And so
which is the reason why healthcare is becoming even more important, because we are living longer and we are accessing this benefit later in life to a large degree. But we're accessing it at a point where it's extremely expensive because we haven't done a lot of the things we needed to do when we were younger. The preventive. Again, that is really due to lack of education. You can't correct something that happened 30 years ago that people didn't know. I mean, you have to really think about that. For example, obesity rate recently went down for the first time. Okay,
but is it that they didn't know, or they just didn't do? Because, and the reason I asked that question is because I remember even in first grade that we were told, what they had, the food pyramid, you were taught the things that you should be eating and some of the contributing factors that make you have bad health, bad habits that you begin very early in life. So people have been told.
Well, I think the difference between now and then is then they told you as a child who went to school. I'm not trying to be funny. I mean, that's how the information was delivered. That is absolutely true.
That's true. It was.
And they didn't deliver a lot of information directly to parents. So it's one thing for you to learn the food pyramid and understand how important it is to eat healthy because this is what they taught you in school, but your mother doesn't understand the same thing and the same importance, so she fixes you something completely different for dinner. Now, we as a society are attempting to hopefully educate not just the children about how important it is to eat well, to also educate the parents about how important it is to enforce good eating habits, because these are things that will help them not only when they're a child, it will help them be better adults. So I think that's the difference. I mean, before we just taught the kids. I mean, we had to start somewhere, and before we didn't teach anyone. We didn't really talk about nutrition, health, and things like that. So I do think it will evolve. Has your in Canada and countries like that got there before we have? Absolutely. Absolutely. I went to Sweden, and I can tell you, I spent like 15 days there, and I didn't see anyone that I would remotely consider overweight.
Wow. And this is just regular population.
I'm talking about regular population. I was staying with family and, so I wasn't in the tourist sites. I was, in the neighborhood.
So what?
I just didn't see anyone with remotely what you would consider overweight. I asked my cousin about it. He said for the most part they're not, and people who are, they stay inside for the most part. I hate to say that, but that's
they don't want to deal with. Well, we're going to talk further about this and perhaps the public shaming aspect of this. But we're going to go to break, and when we come back, we're going to talk about lifestyle changes and some other issues concerning just the health care reform.
Okay.
So we'll be right back.
All right.
Mastering math can be big fun. Fun for you and everyone. Play it each and every day. Master math the easy way. Sing, play it, Math Maze.
Why not turn math time into fun time with Math Maze, the new game craze? Get yours today at mathmaze.us.
Mom, now you can help your son master math and have big fun. Play it each and every day. Master math the easy way. Sing, play it. Math Maze.
Make sure your child owns the skills necessary for success in high school algebra. Get it now. Mathmaze.us. Mathmaze.us.
Dad, now you can help your daughter play it like you know you oughta. Play it each and every day. Master math the easy way. Say it, play it. Math Maze.
Math Maze cards contain both Spanish and English. Get yours today at mathmaze.us. That's mathmaze.us.
Taking my freedom, putting it in my car, wherever I choose to go. It won't take me far.
Thank you so much for joining me for the Carolyn Holt Show tonight. If you'd like to call, the phone number to participate in tonight's show is area code 323-293-3375. Again, that's area code 323-293-3375. We're talking to Kim-Lai Jones, who's a partner with NELLA Insurance Services. And we're talking about healthcare, and she was making the point when we went to break about having visited Sweden and the lifestyle and how the whole country buys into a healthy lifestyle in every aspect. You were talking about if you go to a restaurant, portion.
If you go to the restaurants over there in Sweden, the portion sizes are much smaller. There's not as many fried foods on the menu. More seasonal, local fruits and vegetables. There's,
So it's a mindset.
It's a mindset. It's the mindset not just of individuals. It's the mindset of the country. That's what you begin to feel.
Okay.
Like it's the mindset of the country. Their cities are set up so that they bike, they hike, they promote those sort of activities. They get time off to do certain things that we don't. I mean, so it's promoting a healthy lifestyle because health is important. They all pay. They're a single payer system. So, you want to make sure that their society is as healthy as possible. So, yeah, you get that feeling. You don't get that feeling here. You get the feeling that corporations can advertise, put out. It doesn't matter, like how unhealthy it even remotely looks.
You mean like Jack in the Box?
I saw one where it was like a cheese and a Cheeto or something, a jalapeno in a Cheeto or something else.
The bacon and butter burger is the one that I find fascinating. I'm like, man, you talk about a heart attack on a plate.
There you
Bacon,
go.
Butter, and beef, all on one plate.
All on one plate.
But back to the health care system. What would you say the number one, I guess, con or the negative would be for the that people at least buy into that's a negative for the single payer system. I see it as a win-win personally, but I do know that there are a lot of critics and there are a lot of people who object, and they have some reason for their objection. So what would you say the number one objection?
Number one objection to a single payer system is the cost of time they believe that it will take to receive services. For example, there are certain doctors right now that only take Medicare. So some individuals may, if you are on Medicare and you can only go to these specific doctors that take it, your wait may be a little longer. And so that's one of the main issues, the reason why people do not like single payer systems. They feel like everyone is thrown in and there's no more special pools, as I call them. But the single payer system wouldn't stop health insurance agencies from offering what I will probably call, let's say, a platinum plan. Let's say, they'll provide coverage for us all at a bronze or silver plan. And if you want additional services, if you want access to certain doctors, shorter wait time, you're going to end up paying for those things. So that's the biggest complaint. And if you don't like government, government will have to grow to accommodate. Well,
the big information that you get now is that if anything is changed, 23 million people will lose coverage.
You mean coverage under the proposed Republican plan that they are talking about? I don't. There are some ways to tweak the Affordable Health Care Act. There are things that needed to be fixed in it from the beginning. And the Democrats knew that. The Republicans knew that. But the way that they're attempting to fix it at the current moment, it will leave 20. It's not just it'll leave 20, I'm concerned that it'll leave 23 million people uncovered. But that's just the beginning of the story.
Okay. Well, tell us the rest of the story.
Aside from leaving 23 million just people uncovered just in general, the gaps in coverage and the holes in coverage that it will leave for the people who are insured is ridiculous. For example, under the Affordable Health Care Act right now, there are no lifetime maximums. Under this new proposed plan, there very well could be. So you could buy into a policy that has $1 million for a lifetime maximum, and that's all you're eligible for. And after that, you'd have to pay dollar for dollar for your services. So, there's some gaps in. But
not to cut you off, but if you have to pay and you're getting older and you're getting sicker, that's kind of unrealistic, though.
It is, but that is how the pool is set up, and currently. The way that they have it set up under the proposed plan, the older you are, when your income is more fixed and set, you'll pay higher premiums. I mean, that's just the way that it is. Like I said, not allowing your kids, they want to repeal whether your kid can stay on your health care plan to age 26. Okay, for me, that's not that big a deal. A lot of times it's more cost effective for your 24, 23-year-old to go get their own insurance anyway. That one's not that big a deal. But not providing maternity care, which is one of the issues. Having a baby could be the most expensive thing that could ever happen to you, as a family. Children also are covered during childbirth. They're covered for the first 30 days under your personal health insurance. One of the proposed components of their bill is to remove that, so your child would not automatically be covered during the first 30 days.
Wow.
So then what do? You got to go secure health insurance. So
yes,
there's just issues with all of it across the board.
It will cause you to make some critical decisions before you make critical decisions in your life. That's for sure.
Well, yeah. I mean, if you have to wonder whether your maternity care will be paid for, and then we won't even talk about the slashes to Medicaid. People are like, oh, I'll go get on Medicaid,
Or Medi-Cal.
Medi-Cal. No, you won't because of the holes that they're putting into those budgets. No, you won't necessarily go get on Medi-Cal and have that same services provided.
Well, you touched a little bit on maternity issues, but just women's issues, period, in terms of women's health care. One of the big concerns is that moving forward, that there are no there's no care out there for women and their health issues, and that's a big deal for most people. So what would you recommend in terms of women and what they should do moving forward to make sure that they are covered?
Healthcare rights for women is a state-by-state issue. I will say that.
And a poor one at that.
It is. It's really a state-by-state issue, and it does seem that the poorer the state is, the more restrictive that the state happens to be in regards to women, particularly women's reproductive rights, and just general women's health care overall. Overall, how do you solve that? I mean, we'd probably maybe under the Health Care Act, they need some uniform laws just go across the board in regards to women's health care, some basic essential benefits, for example. They could build that into health care. We have that currently now. We have some basic, under the Affordable Health Care Act, we have some basic essential benefits. But, as far as reproductive rights are concerned, that always becomes an issue because those rights reside to a large degree with the state. I mean, don't get me wrong, abortion is legal in all 50 states, for example. However, you have states that really do make the procedure extremely restrictive for whatever reason. Access to benefits, access to care, extremely difficult because they don't really support, the state in and of itself doesn't support that right. I don't know how you can change that just through a health care benefit plan.
Well, I think that it has to be, as they say, in many cases, to change things, you have to stop being just a resident and become a constituent, because otherwise you don't get any representation when decisions are being made on your behalf. There's nobody there to represent your concerns and your needs and your thoughts. And so
it has to be more women and have to be concerned about their own reproductive rights. I mean, I could be wrong, but I look at it I could be wrong, but when I look at some of the states that have very restrictive reproductive rights for women, I really wonder, do the women of those states actually vote? Are they voting, or are they voting on one issue and not really paying attention to the other, thinking that someone else is going to come save them on that issue? You know what I mean? Like, I'm going to vote conservative because, I like their position on taxes, and that overrides their position on women reproductive rights. And I'm not going to worry about women reproductive rights because enough other people will be unhappy about it that they will fix this for me. And that is just not the case. I mean, men, particularly in, seems to be southern states, they have their own ideas about women reproductive rights, but it will take the women of those states to get to vote.
Well, just
to vote.
I was just going to say, not just in southern states, but period, but also in the South, there is the issue of faith and religion and all of that, and many times that comes into play in the political arena. And I would say that women are following the lead of men because, they, like you said, they are trusting them to make a decision that will protect them. And,
here's what I'll say when people try to bring in religion into women's health care. Religion can be used as a weapon against anything. If you really want to tear something down, you can find a scripture in the Bible that will make you feel like what you did was absolutely and utterly and totally wrong. And my whole thing about women's health issues is that is between a woman and God at the end of the day. Not between me, my pastor, and God, not between me and the priest and God. At the end of the day, a woman's right. We all get to make our own decisions. We live and die by those decisions. We have to answer for those decisions. And as a woman, we should be able to make those decisions with our body and answer to God for them if we don't make the right decision. I'm not saying that people have to agree with everyone's decision, but I do believe we owe people that a certain level of respect about their decisions. In regards to those areas.
And therein lies the issue then, because if it's based on faith, that it just doesn't work like that, and perhaps that's why we do have some of the.
I'll just say they all need to stop picking and choosing, because you can they need to you're gonna not promote women's health care because of faith, but you'll break every other rule in the Bible. That really makes no sense.
Now we're not because we're not discussing what makes sense, but just the premise by which the decision gets made.
Yeah.
And
we have
I
to vote. I
yes.
mean, more than anything, women have to vote, and not vote along the lines of their husbands just because of, and this has to become an important issue. But I do believe that a lot of women in states such as Texas, which has like some of the most restrictive women reproductive laws in the country, I do think that they'll try this for a while and then they will reverse.
You think so? Okay.
I think they're going to try it for a while and then they will reverse, because it's about life and death, and not just the unborn child. A lot of times it's about life and death of the mother. Mm-hmm.
And when it is, you and I on the way over here, we were talking about the case out there now with the young man that the Vatican says that they will take the child in because it's an issue of taking the child off of life support.
Life support.
And that it's highly charged emotionally, and to the parents, they believe that their child is still alive. The doctors say that not only is he not alive, he's just on life support, and there is no possibility for recovery. Well, people of faith, they don't necessarily accept that because they believe in miracles, and they believe that if they pray to get a desired result, that's what's going to happen. So it's hard to square these kinds of issues because, as we talked about, then you have to get into, well, is health care a right or a privilege, and a right and a privilege for whom? So,
every day holds a possibility of a miracle. So,
yes.
I'm going to say I absolutely do believe in miracles, and I do believe that things can change.
Yes.
But I do believe also that there comes a certain point, I mean, it gets to be really tough, that if you believe in miracles, if you believe God is going to heal, then you test that faith. And if I don't think we were meant to live on life support. However,
yes, it's a personal
individual. I'll just say, if you have faith, then you should, and if that's what you're claiming, the reason why you want to keep your child on life support, I'll say step out on that faith, because if he was meant to be here and exist in that format, then he will continue to. And if not, he will pass away into the arms of God. A decision will be made. But the part that gets to be really difficult about this decision for most people is, how do you tell someone that they should basically lose their child? I mean, I don't know. I mean, I can't imagine having to make that decision myself. And then, but it's also hard to tell people that they need to pay, millions and thousands and thousands and thousands of dollars in support of your choice. That is also difficult, and that is one of the biggest issues in healthcare. Is like, where do you draw the line, if one can be drawn at all? I'm not going to say that I think that it necessarily can be or should be, but there are some economic costs.
Well, I think that's the big sticking point right now with healthcare is the original or Obamacare or the Affordable Care Act was a very large, comprehensive bill. And in examining it and trying to pick it apart and trying to make it work for everybody, so far there haven't been any alternatives created. And like you said initially, it does have some areas that perhaps need tweaking, but how do you do that? It's very hard to take in everybody's thoughts, feelings, opinions, and ideas and condense it down and say, okay, well, this is where we can finally replace something or we can change something. So moving forward, it's a lot to think about. And I don't think any one person, including Democrat or Republican, has a solution. So this may be a situation of just leave well enough alone.
I think our system does need to be fixed. I mean, the Affordable Health Care Act was a great place to start. It really was. It was a fact. We had to start somewhere. I do think that our system will eventually be modeled more so off of a European system. In the long term, we will have to adjust to paying more in taxes. As a society, I think that we will, as we begin to value and understand the need for healthcare, as we begin to value it, the benefit, as we begin to understand the need for it, and to really get younger people to understand, this is something you pay into. You pay your dues. We all pay our dues. There will be some of us who will never be sick, and there will be some of us who will be sick all the time. But as a society, if we all pull together, we can.
Yes, we can make it happen.
We can make it happen. I mean, we absolutely can make it happen. The biggest issue that they don't talk about in healthcare, and probably the one that worries me more than anything in the healthcare system, is really the fact that we don't have enough doctors and nurses. They keep talking about fixing healthcare, but until you fix, you can't deliver services, you can't deliver quality services if we don't have the facilities nor the staff to support the population. And that is a bigger issue than anything that they're talking about right now, my own personal opinion. That's one of the, that's also a driving factor in regards to cost, because, the pool of doctors, the pool of nurses is small, so the wages, keep rising, which is great on one hand. They're making more money, but on the other hand...
Now, you mean doctors and nurses are making...
Doctors and nurses and there's just a shortage across the board in the healthcare industry, from everything from home healthcare nurses, which absolutely don't make enough money, but there absolutely is services that is needed.
Right.
To we don't have enough doctors and nurses. That's just the honest to God truth.
Well, maybe though that's a good place to start in terms of recruitment and getting people to, especially young people, to think more in terms of careers and how they can get.
Healthcare is one of the fastest growing jobs and industries in the country, but right now it is not keeping pace with need. Absolutely is not keeping pace with need.
But I think it's also one of those areas. It's like teaching. I mean, it's teachers are so critical, and they impact our lives, our children's lives in such a valuable way, but yet people don't honor them in terms of salary and in terms of the invaluable service that they do, because essentially they take care of our families for us.
That is very true.
Every day.
That is very true
So-
across the board. But again, like I said, the healthcare crisis that we will see come next won't be whether we can afford to pay for health insurance. It will be whether we can find a doctor that we can pay, that we can find.
Well, that's what I'm saying, and so that's a PR campaign there. You need a great PR person to start telling youngsters, like they did when I was growing up. They would have commercials about things that they needed.
We need,
and so
more kids in math and science, and more individuals going into the healthcare field. And we need to pay the individuals who are in the healthcare field in fields like in-home care services, which is what individuals get before that they need to go into a nursing home or hospital. We need to pay hospice. We need to pay those individuals more money so that we can continue to.
And that's another issue, the issue of hospice, because then you're it's a really, to me, it's one of those circumstances that, because the person is at the end of their life, basically. But since you don't know when that is, I think it's necessary, but I think people have a real hard time in terms of thinking about hospice before they get there.
Well, that is true. But I'll just say hospice care, having known someone who's gone through hospice care has evolved. Part of the issues, some of the things we think about with healthcare, particularly when we age, we have these very bad pictures in our head of facilities, where people are just left alone and things like that. And I'm not going to tell you that facilities like that may not exist. I'll just say that, again, society has grown. We have moved forward. We need these services now more so than we ever have because of the shifting age in the population. Mm-hmm. So a lot of these types of services overall, they've improved. So hospice care is designed for if they feel you have 6 months or less, but a lot of people stay in hospice care a lot longer because those miracles.
Yeah. I've had my sister, as a matter of fact, was in the hospice before. They were making the decision, and she unfortunately had a major heart attack and passed away. But it is, it is planning. I think healthcare is a lot of planning, and maybe that's what people.
Well, like I said, overall, the way we truly fix healthcare across the board is we have to have a shift in the way we think about our health in general. Mm-hmm. And we have to start that when we are young, so that the young kids grow up with those mindsets, and hopefully as each generation passes, we become healthier. Mm-hmm. It will take time because the people who are, people are not going to stop eating pizza at this particular point. People are not going to stop drinking Coke. I don't care how many times they show you that you can clean your toilet with it. People are not going to stop drinking Coke.
Well, now, wait a minute. You can clean your toilet with Coke?
Yes, that was one of those things on DIY.
Well, I didn't see that episode.
Yes, they showed the pouring Coca-Cola into the toilet and then scrubbing the toilet with it.
Wow.
Yeah.
Well, we'll have to talk about that more off the air because I didn't see that one. But just in terms of thinking about healthcare, though, you're right. It is getting everybody at least headed toward the same page.
You have to get one of the biggest issues I'll say with getting everyone headed to the same page is that people are not in the same bucket. So the entire workforce who receives their health care insurance through work, they don't even think about it. Oh, my employer is going to pay this. They're going to take that. I'm going to be able to access. So you have a huge constituent who should be interested in health care because they may need it one day, but they don't even think about it because they have group insurance. And they're like, oh, no, I don't have to worry about whether we're on a single payer system. I don't have to worry about whether there's carriers in the market that I can access, whether I have choice or not. Because I'm on a group plan. And so you have a large constituent in healthcare that are disengaged because of that. Like, for example, all federal government workers, they're disengaged when it comes to healthcare. I mean, think about it. They get it through this,
I know, because that's how it was sold to us in the first place, that the president said, everybody should have access to what we have. We have access to the best doctors. We have it at a reasonable rate, and everybody should have access to that. Well, then, if that's true, to me that seems a simple enough thing to do. Then why are we not doing
Again,
that?
that would look something more like a single payer system, and there's just not a lot of. Although it's catching on, there hasn't been a lot of support for single-payer systems. It's going to be expensive to set up. It's very expensive to set up. Setting the guidelines and rules for it is going to be extremely difficult.
That's one of the things I have on my list. It says that the information technology to administer the programs could cost billions of dollars. Now, is the cost more related to personnel, or? I
mean, it's across the board. I mean, it's related to personnel, the staffing you need to service those sort of individuals, the computer systems you need for medical information, to hold medical records, privacy issues, you name it, across the board. It's expensive. I mean, right now, medical record keeping, electronic medical record keeping is, people do not keep files on their desk. Doctors don't keep files and things on their desk. Most of their records now are electronic.
Right.
Probably at one point, I would dare to say it was less expensive to keep your records that way, but I wouldn't say so now. There's so many privacy and security concerns and different things that, it's not as cost efficient to be per se as paperless as it was before.
Right. Well, and speaking of privacy issues and medical records, I have found, especially recently, that there are a lot of errors in the transferring of information. And I was speaking to a doctor just 2 weeks ago, and he was saying, the speed. He said normally it's like a data entry error, but that's another thing that you really need to pay attention to what's in your medical records.
Most people have no idea what's in their medical records because we all go to the doctor scribbles something on a pad. About our health. He takes all the tests, he says these things, and he goes off about his business, and all that information is in a file. Most of us have absolutely no idea sometimes. They may tell you, oh, here's your medical screening. We did your blood work. It all came out perfectly. Everything was fine. But you don't
Well,
get a
most of
copy
them have
that.
portals now that they set up that, if you go to the doctor, you can have access, and they'll send it to you on your computer, and you can take a look at yourself and see how you're faring. And
how many people really do that?
I just assume everybody would do that.
Most people do not ever look at their medical records. I would just tell you, most people don't.
That is so strange.
Most people do not look at their medical records.
Well, they need to, because they can have very jeopardizing information in there that has nothing to do with you. I know an individual right now that had some really awful information in their medical records that was absolutely not true, and they had to go to
the medical information board.
Yes, to get it.
That's the only place you
corrected.
can actually get it fixed, because there's so many different medical providers, and each medical provider presents their own information. And so when you want your medical records really fixed, you really have to go to the medical information board, which most people don't even know exists. zero.
And I can understand that.
Zero.
Perhaps if it never comes up in your life, I can understand that. But I'm just saying that's one of the areas that perhaps you need to really be proactive in, because it's not as accurate as you know.
That's true, but not
might
every.
think.
I will. Let's say Kaiser probably has the best electronic online medical record keeping system, but not all healthcare companies keep everything.
Well,
online.
Cedars, they have an excellent one as well.
Oh, I'm not saying. I'm just saying,
Yeah,
but not all healthcare companies, because they are not all required to keep all of their information in one database. So HealthNet is different from Anthem. Anthem is different from, Anthem Blue Cross of Texas. Their databases are different. So Cigna. Their databases are different. So if you've switched coverage 4 or 5 times, it can be extremely difficult to track your medical records. Most people don't.
Yeah, but with the electronic delivery system, I think it's getting a lot.
It's
better.
getting better. It's getting better.
Yeah,
it absolutely is getting better.
Well, in tonight's show, our goal is to try to, I guess, make healthcare as easy as 1, 2, 3 for the regular lay person, because I think that it probably impacts that person most, and then they're the ones that really need to take some time to figure out what is in their own best interest and present that, but understand that that's not what healthcare is about. Healthcare is something that needs to work for everybody concerned.
It needs to work for everyone concerned. Let me just tell the people out there who buy individual health insurance, one of the things I want you to really keep in mind, that you buy individual health insurance for 12 months, okay? So, and I say that because people they buy these plans and they worry, oh my God, what happened if I took a plan that had a high deductible? Had these out-of-pocket costs because I needed to lower my monthly expense. Just know that, keep that in mind, what you have to, at least under the current system, let me just say that, under the Affordable Health Care Act, as it stands today, if you happen to get really sick and you took a high deductible plan, know that next year you can switch to a plan that has a lower deductible but pay a little bit higher out-of-pocket. Really pay attention to your own personal health care costs. Don't just go, oh, I never get sick. Yeah, you do. Think about, the times you go and buy your NyQuil and all those kind of things. And consider those costs, and how much you can pay for yourself. I do say that, you should have, there is nothing worse probably than getting a bill that's $4,000 or $5,000 that you cannot pay. For something that you could have paid $200 or $300 for. So I'll say, buy your health care according to your lifestyle. So if you're a fast driver, you need, to buy insurance with a lower deductible.
I was just going to say, but what are the circumstances that create the high deductibles? Because that is a concern for a lot of people. So what?
I mean, honestly, it's just a matter of costs. Right now, we have bronze, silver, gold, platinum plans. That's how they are ranked, no matter what insurance carrier you're with. Bronze plan is for someone who just doesn't get sick that often and who's willing to gamble. That's what I say. So, I mean, and that's not a bad thing. I mean, when you're 18, 19, 20 years old, and remember, you're gambling for 12 months. It's not for the rest of your life. You're gambling for 12 months. So, bronze plan may have like a $6,500 deductible. Currently, under our current system, there's certain things that you won't, even with that deductible, you won't have to pay for. So you won't have to pay for your annual checkups. So, you say, hey, outside of my annual checkup, I'm going to be fine. I'm not going to have to go to the doctor. But if I do, I know I'll only have to,
But the $6,500, that's the cap? Is that what you're saying?
That's the cap. And that's your worst case scenario. $6,500 isn't when you go to the doctor the next time you got to pay $6,500. You could go to the doctor and the bill could be $90 and you got to pay that $90. But $6,500 is your worst case scenario. That's you, for example, getting, run over by a car and you're in the hospital. $6,500. That's not, That's not a bad deal for $6,500 out of pocket.
Well, what is the? What would you say is the? You said the bronze is
Bronze,
like the
silver, gold, platinum.
So what is the? Is it about 120? Is that about the average?
The deductibles. I mean, for the most part, a platinum has a 10% deductible. A gold has a 20, a silver has a 30, and a bronze is like a 40. That's a good way to look at it, like how much you'll have to pay out of pocket. So, under bronze plan, you're going to have to pay quite a bit out of pocket after your essential benefits. Mm-hmm. Almost everything you do after you pay for your essential benefits, you would have to pay a copay on. Okay. If you have that plan. But, you buy that plan when you're 20 and you're not sick. You buy that plan. You buy that plan when you're younger. Okay. You buy that plan when you're not sick, and you understand that, hey, people are like, oh my God, well, what happens if I get cancer? Okay, you get cancer, you pay your $6,500 for this year, and then you switch to a plan next year that has a 10% deductible. At least under the current system.
I was just going to say, but if it changes, then what? What?
I mean, we'll have to see what it looks.
Because that's what I think. That's what the fear is that something is about to change.
If it changes, I mean, you may not have those options based upon some of the plans because it depends on how they cover pre-existing conditions. What can health insurance companies cancel or not underwrite you for those things? It will really just depend on what plan that they put out. It really will just depend on what plan they put out.
So we are left to wait.
We are left to wait and wonder because I don't know. I really hope that the powers that be are not crazy enough to pass this plan as it stands, and if it does, that the final signature on that is not crazy enough to sign it. And if he does, I'll just pray that we'll get through 2020 and we'll vote him out and have somebody undo what he just did.
Apparently, that's not possible because he has already started to raise money for his re-election.
You can't stop him. You can't fault a man from trying to get a head start. We try to tell people to prepare early. I mean, I don't really have any issues with him starting early. I mean, he's not doing much of anything else. So.
I was just going to say, but you should be doing something currently in order to think that you're going to carry that into the future. You need to have something to carry into the future.
Well, hopefully there's enough pushback right now. I mean, I don't know. I really, really, really just hope they do not pass this health care bill as it stands. It will be detrimental to a lot of individuals. And I guarantee you, everyone thinks it's going to be the poor. It's not. The middle class is going to be hurt.
Mm-hmm. As they are already.
They're going to be hurt worse more than anyone because right now, the poor already has Medi-Cal.
Yes.
So they're already covered under that. So, whatever they gouge out of that, it's going to really hit the middle class. And what they're doing to people with disabilities is it's going to be disgraceful. Mm-hmm. Under this legislation. It's going to be disgraceful. We'll see how people feel about that too. When they realize Mary has been living on her own, even though she uses a wheelchair. Now Mary can't live on her own. Mm-hmm. Those costs will rise. So yes. I do feel that in the end, though, we will end up in a single payer system, but it'll be years from now.
Oh, okay. Well, on that note. We want to thank you for joining us to hear the basics about healthcare because we don't know everything, but we at least wanted to clarify the little that we do know. And I just want to thank you so much for joining me. And as always, our intent on this show is to move you from misery to magnificence and from subpar to spectacular. Thank you so much for joining me tonight and have a wonderful evening. Bye.
Mastering math can be big fun. Fun for you and everyone. Play it each and every day. Master math the easy way. Sing, play it, Math Maze.
Why not turn math time into fun time with Math Maze, the new game craze? Get yours today at mathmaze.us.
Mom, now you can help your son master math and have big fun. Play it each and every day. Master math the easy way. Sing, play it. Math Maze.
Make sure your child owns the skills necessary for success in high school algebra. Get it now. Mathmaze.us. Mathmaze.us.
Dad, now you can help your daughter play it like you know you oughta. Play it each and every day. Master math the easy way. Say it, play it. Math Maze.
Math Maze cards contain both Spanish and English. Get yours today at mathmaze.us. That's mathmaze.us.
The babies. And since a man can't make one, he has no right to tell a woman when and where to create one. So will the real men get up? I know you're fed up, ladies, but keep your head up.